apologies from Karen Turner. Paul Ryan is attending as Karen's proxy. We have an apology from Alan McNiven, and Alice McBride is attending as Alan's proxy, and we have an apology from Amanda Ward.
Thanks for that. Okay, item 1 is the minute of the previous meeting, so that's from pages 5 to 12. I don't intend to go through them, but if anybody's got any questions, comments. No, so it's an accurate reflection. So that's agreed. Item 2, the appointment of the new chief officer. So that's on page 13 to 14. So that's just to officially ratify Billy McLean as the new chief officer. He'll be joining us in August. So this will officially be your last meeting then, Karen. Yeah. Oh, listen. So on behalf of the board and all the staff, thank you for your hard work. Honestly, you came on board at a really challenging time and you've done a fantastic job. So we're lucky to have you and to still have you. Okay. So the next item is item.
Just formally approved.
Oh,
sorry.
Sorry. Ian.
Thanks very much. Certainly, I look forward to working with Billy McLean. I have never met the chap, so I'm looking forward to meeting him and working beside him. But just would like to thank Karen for what she's done in the last few months. It's been, as you say, Chair, it's been a very, very difficult time to take over in the middle of the Sustainable Futures programme and all the rest of it. So well done to you. But I've got one wee question. Normally in the council, and I know we're not the council, we would normally get a paper saying who the interviewing panel was. Can I ask who was actually on this interviewing panel? Because I don't know.
It was organised by the NHS,
Right.
HR, so it was the leader of the council and Mags. Who else was on it, Mags? The NHS chief exec? And yourself. So 2 chief execs, Margaret and Ian.
So there was no voting members from the council, and it was the leader of the council. Right, okay, thank you.
Right. Jacqueline.
The same comments as you both made, Karen. We so appreciate the input from you, and you're an absolute trooper, and we're glad that you're still with us as well. So thank you.
That's agreed. Right, so item 4 is item 3 is the chair and vice chair of the IGB and the IGB Audit, Risk and Scrutiny Committee membership update. So I'll hand you over to Mark.
Thank you, Chair. This report's a fairly standard report because, as members will be aware, we have a rotating membership of the chair of the IGB itself. It rotates between the 2 bodies. So this, in effect, will be your last meeting in the chair before moving to vice chair, Councillor. The report will set out that Margaret Kerr will be taking on the role of chair of the IGB going forward. There's then no questions in respect of the IGB Audit, Risk and Scrutiny Committee. So we require a nomination of a chair from the council membership on that board. And I understand we need a nomination for a member of the board from the health board, and then again the appointment of a vice chair from within those memberships. So could I have nominations, please?
I nominate Lisa Mayhews as the chair of the IGB Audits and Scrutiny.
Chair.
Oops, sorry, I was just saying I would nominate Lisa Marie. She's currently the vice chair of the Audit and Scrutiny, so I would nominate her to take over as the chair when Mags leaves.
Do you have a seconder for that, Chair?
Councillor Cameron.
Councillor Cameron.
Thanks.
Any other nominations? No. Okay. And in relation to the health board?
Max.
I nominate Kath Cooney, please.
And who's your seconder? Sorry, ma'am. Thank you. You got those away. Again, no other nominations? Excellent, that's confirmed. Thank you.
That a historical hand in? Is that a wee historical hand on the screen? No, you're waiting to come in that item?
When I read these papers, I couldn't believe this was your end of your tender as a chair. You only seem to have been the chair for 5 minutes. The last couple of years have obviously flown by. So I think you've shown yourself as a chair that cares. And I think there has been some decisions that you've made that have been against the recommendations of officers, and that's always a very difficult thing to do, to stand up to what's expected of you. And I think you have done the unexpected at times. So well done for that. I know you're not going anywhere. You're going to be here as a member of the IGB, and I'm sure you'll continue to make a contribution. In the same breath, I wish Margaret well. You're taking over at a very, very, very difficult time, and I hope, and I know you will take your job extremely seriously. And I know you've been at a number of the meetings recently, meeting with members of the public. So good luck to you on that. And also, Mark Halliwell, it's your last meeting today as well. I've known Mark for a number of years now, through various things, and he's very much a caring person, a people's person, and his contribution to the IGB will be missed. So I wish him well for the future, and I'm sure our paths will cross in the future, Mark. But best of luck, mate.
Thanks. Yep.
Sorry, apologies, members. In terms of the 2 health board members who are appointed to the Audit, Risk and Scrutiny Committee, I should have asked which of those 2 is going to be Vice Chair.
Nominate Kath for that as well.
Thank you.
Just before we move on to the next item, I thank Ian for his words, and to also highlight, Mark, that this is your last meeting as well. So I really appreciate your contributions, and I wish you all the best in the future. Don't hesitate to contact us if you need a reference.
Thank you for those kind words. And I just want to say something about the board. When I came in to join this board, I was terrified, and I honestly believed it was them and us. And I walked in and I was made to feel so welcome. And I honestly feel I'm leaving this board not just listened to, but being heard. So I thank you all for this part of my journey.
Thank you, Mark. I wish you all the best. Okay. Item 5. Just give me a second. Sorry, item 4. Oh, sorry, apologies. There's still hands up.
And it was nice things I was going to say about you, so you really want to bring me in. just the same, just to say well done on being chair. I know that when we talked about it, I'd been chair for 5 years, and when I was elected in 2017 and I was asked to do it, it was a daunting task, and it was through COVID, and but I know that we talked about it, and you've done a great job, so well done. And as Ian says, you'll still be there, and thanks to Mark as well for his time. And I'm not sure if this is in the paper, but we've got a new service user rep, and she's also a member of the Renfrewshire Lived Experience panel, so I had to get that in there as well.
Absolutely.
So just welcome.
Thanks. Thank you, Councillor Cameron. And Councillor Hughes.
Thanks, Jen, Chair. I'll be brief. Well, firstly, I would echo what both Ian and Jacqueline have said about you as Chair. You're very much a person who cares about people and cares about getting things right, even when that's not the easiest thing to do. And I think you've been a brilliant Chair. But I also just want to, we've just kind of officially removed Mags from the Audit Committee. We have spent 6 years on the Audit Committee together, not including obviously the 2 years that I wasn't in the IGB. Mags is obviously an auditor by trade, and her knowledge and experience in that IGB have been absolutely essential as we've, in the Audit Committee, as we've reshaped them. I think the Audit Committee is in better shape for having had Mags on it, and I think that should be noted.
Yep, absolutely. So I totally agree with that. Right, okay, if everybody else, no more hands up, we'll move on to item 4, which is your Chief Officer's report. So for the last time, we'll hand over to you, Karen.
Thank you, Councillor Adam. And I would just like to add my thanks to everyone else's in terms of your chairmanship of the Integrated Joint Board. I know it's been a challenge at times, but it also has reflected your strength of character and your professionalism, and also your humanity and compassion. So you have certainly led the IGB through some really challenging times, but also always with dignity. So thank you for that. And similarly to yourself, Mark, you will be an absolute loss. And again, you bring compassion, humanity, and a balance to some of the discussions that have taken place. So as Interim Chief Officer, I extend my thanks to both of you. So thank you, and I'll go on to the report. As you can see, again, the Chief Officer report, it really shows the shift and the change that's been happening at pace, and particularly some of the challenges since we last met on the 21st of March. And I think it does reflect that within the report, particularly some of the national changes that are taking place. What I'm going to do is really just pick out some of the key highlights, and I'm going to focus down on the carer strategy, because in terms of a shift and a move away, the report really is normally just for noting, but in this circumstance, I'm asking the IJB to approve the recommendations around carer strategy, but I'll get into that in a bit more detail. In terms of the key updates, as you'll be aware, the report picks out the excellent performance around delayed discharge. And again, in Renfrewshire, for the third year in a row, we have been the best performing health and social care partnership for standard delays across Scotland. And that's again at a time where we've been trying to manage a number of changes and a number of priorities. Also, the report sets out 100% performance of CAMS against a national performance target of 90%. Included in the report also is the PCIP updates and the arrangements for the delivery of our local vaccination programme. And again, that includes some of the changes, particularly around the infant vaccination. The report highlights a number of national policy updates, and there's been a number of policy updates that have come out recently. We've had the publication of the NHS Scotland Operational Improvement Plan. We've had the Scottish Government's programme for government for 25-26. We've also had the NHS Scotland Agenda for Change pay deal, and the very recent publication on the 17th of June, the Population Health Framework. As well as all of that, the report details the government's commitment to progressing the National Care Service, including legislative steps to introduce the statutory rights for breaks for unpaid carers, a very welcome inclusion. In support of this, the carers' additional person payment has been included, and that will offer financial recognition of the work of unpaid carers. And again, as I said, very welcome. A further update will be brought to the IJB on more detail as we start the implementation of the government plan. As I said, importantly within the report, the IJB are being asked to approve a review and a refresh of our existing IJB Adults Carer Strategy. The Carers Act states that following a review, the IJB may prepare a revised local carer strategy, and that what that means to us is that we don't necessarily need to develop a new plan every 3 years where that's not required. Having considered our current strategy, the HSEP are seeking approval from the IJB to undertake a review and a refresh of our existing strategy, which will take us to November 27. There's a number of rationale for that, but most important is really the priorities remained fully relevant, and they were based and developed with our care strategy group following a number of following a huge period of co-production. The refresh plan will also include the impact of our sustainable futures and also those wider policy developments, particularly relating to the right to breaks. Should the IJB agree the proposal, we would bring a draft strategy to the future IJB in November, outlining the new plan. Happy to take any questions from anyone.
Just there's so many aspects there that I welcome. Can you say the statutory right for breaks for carers, fantastic. Performing well in delayed discharge, given all the pressures that you're currently facing, fantastic. So, but as you say, it's not normally it's just for noting, but actually today it's to ask for the approval to obviously extend the adult care strategy to 2027. So do we have any questions or comments in regards to it? Councillor Millen.
Thanks very much for the report. I've just got a couple of comments and one question. Again, good work on the delayed discharge. You know, we get these reports every 3 months, but as I say, it's fine getting to the top of the table. It's staying there is a difficult part. So well done on that. And there seems to be good work on the CAM service. I think I'm not alone in saying we were a bit concerned when it was kind of Eastern Bartonshire were taking over. Nothing against Eastern Bartonshire, I'm sure they're lovely people, but it's, when things go to a kind of control from a distance, I certainly start to get a wee bit of concern, but there seems to be continuing the good work there. The seasonal flu, I'm glad to see that's already started. I was speaking to people the other day who were going for various jags, so it's good to see that going. And I know last year was a particularly bad year for flu in Scotland, and a lot of people tend to dismiss flu as if it's just a heavy cold. No, it's not. It's a killer. Or a potential killer, so it's great to see things moving on, and no doubt the NHS will be doing plenty of publicity to make sure that people continue to get their jags. And I know some people are a bit fed up with jags and a bit jag bored, if that's an expression at all. But it's vital that people get their jags. I know it's a pain and nobody likes getting a big needle stuck in their arm, but it's got to be done for the greater good of not only the individual but for the whole of society. The question I've got, and I hope you don't mind me asking this, and it's not really anything controversial, but yesterday at the council meeting we discussed about the Lang Bank service. I don't know if we can maybe touch on that. I'm not entirely sure where that's at. I didn't have any great knowledge of it, and it was only a local member that raised it. And we touched on it yesterday, although we were talking about another issue that was kind of flung in at the end. So if you can maybe just provide a wee bit an update, because I'm a bit concerned that potentially losing some services here in Renfrewshire, although I know that and by a bizarre twist of fate, that's controlled by Inverclyde IJB, which I think is a bit of an anomaly, to say the least. But if you can maybe just clarify, I'm sorry if people are not entirely sure what I'm talking about, but just looking for a wee update from you, Cam.
No problem, Councillor McMillan. I'll actually hand over to Stuart Sutton, our clinical director, and he'll be able to give you the detail around that.
Yeah, thanks very much. So I think the slight complexity with general practice primary care provision is it's contracted at a board level. So although we have oversight and relationships with the practices in our local authority area, there are quite a few cases in different HSCPs where the practice that is providing cover to patients in a geographical area living in a local authority area may be actually from a different HSCP. So it's not in itself, that is not unusual and unique in Langbank. I think beyond that, the next issue is obviously ensuring that patients have alternatives that they can register with and that they can travel to. So I think obviously this is an ongoing process, so we don't want to prejudge what the outcome would be. But I think if there was a branch closure in Langbank, then patients have been given the option to remain with the practice in Kilmacombe, which obviously they would have to travel to, or potentially Port Glasgow practices which have Langbank within their catchment area. There aren't any Renfrewshire practices that cover Langbank at the moment, and there's no contractual process to require a practice to increase its catchment area. The only practice that is nearby is Bishopton. That's the only geographically kind of adjacent practice. Understandably, colleagues will know that there is significant pressure in the Bishopton area with the Dargaville development. There's a new satellite clinic which is next to Sainsbury's and nearly finished, which I've been inside and is going to be fantastic. That's been a huge piece of work for the HSEP and the Health Board to deliver. But understandably, they don't have the capacity to then take on an additional, number of thousands of patients potentially who are, geographically distant and may require house calls if they are housebound, etc. So that has been asked. The question has been put to the practice in Bishopton, but I think understandably they've said we're already finding it a challenge to prepare for the move into a second site, cross-site operations, and providing care for the rapidly growing population in Dargaville. So I appreciate it seems like an anomaly, but it isn't that unusual across the Health Board. There are examples, for example, in Lochwinnock practice that has a Beath site, which is out with the Health Board entirely. So that's providing services to people in Esher and Arran. So I think whilst, on the face of it, it seems unusual, it isn't that unusual as far as the Health Board and the HSCPs go. And I guess the priority is making sure people have got a practice they can access. That includes Langbank within the catchment, but there isn't a guarantee that that's always going to be from the HSCP that you are residing in technically. So Sorry, that's a bit of a long-winded
No,
reply.
thanks for that
Sorry.
update, Sharon. Thank you. And Mark.
Can I thank you for this report and all the information? I'm pleased to see the proposal for review on the adult carer strategy, which of course includes right for breaks, as you've said, and looking at strengthening the rights for care home residents and law, as this also has an impact on carers. Can I address a couple of points in the report? In point 7.1, it speaks about CAMS at 100%. Now, I know of a case where a child was talking about suicide. The doctor referred it to CAMS. CAMS wrote back without even seeing the child to inform that nothing they could do. The parent then went in and spoke to CAMS and said, I'm going to take this to the medical board. The doctor then did a new referral, and the child has an appointment with CAMS within 3 weeks. So yes, we did reach 100% by sending out a letter. We didn't actually reach 100% in treatment. And my second point is about 11.2 hospitals at home. I mean, I did bring this up at the IGB development session. I raised concerns about the impact on unpaid carers, and I was directed to YouTube videos. I went away and watched the YouTube videos, which were very interesting. I'm still not convinced on the impact it has on unpaid carers. Yes, the service user, they get to eat at home, they sleep in their own bed, see their own friends. But this causes more work for the unpaid carer because they can't go to work, they can't go and pay their bills, they can't go shopping. And if the patient was in hospital, they'd be getting 100% care where the unpaid carers have to do it. So yes, okay, I see it working for the service user and HSCP, but I don't see it working for the unpaid carer. So I have two questions. When will we report on how long waiting times are for CAMS in Renfrewshire and also hold East Dunbartonshire to account? And secondly, how does this hospital at home model support unpaid carers? Thank you.
I'll just come in briefly there. That's assuming they have a carer, Mark, because what we discussed last time was it's not one size fits all. There could be somebody that's physically able-bodied that's waiting for an MRI. So instead of waiting in the hospital for 5 days, we'd go home. Now, I know from somebody that attends hospital quite regularly, I would much rather be in my home environment. I don't think you can underestimate, as you say, being in your own bed, seeing your own friends. All of that has got such a massive impact on your mental health. You're always desperate to get out of hospital for infections or whatever reason you want home. Not to mention the pressure it puts on your carers and your friends and your family trying to go up to the hospital twice a day. See? But what I'll do is I'll hand you with professionals to answer your question. But that's just my take on it.
Mark, I'll pick up the hospital at home and I'll hand over to Pauline around the CAMS. In terms of hospital at home, as Councillor Adams very eloquently said, it would be whether the suitability of somebody for hospital at home or a virtual bed would take account of the care needs of that person, but also the needs of the carer. So if the needs of the carer meant that they weren't able to provide any support to that person, then that would be taken into consideration around that person's suitability. So all of that would form the view about whether that was a suitable route or whether a hospital admission was a suitable route. For people who absolutely require hospital admission, that will happen. It's for those people who could be safely supported at home, taking account of all of the wider circumstances in that person's life. I don't know if that answers your question.
Still a bit concerned, like, obviously when the patient's at home, the carer is doing all the work. I know that watching the videos that there'll be health professionals coming in and out, but when the health professionals are not there, it's still the carer that's doing the work. And that's the bit that concerns me.
And if that was putting additional stress on that carer, then that would be taken into account and a hospital admission would be looked at. So again, I can only tell you in terms of the general overview, the individual circumstances of that person and the decision about where that person is cared for would be made on an individual by individual basis. But I absolutely accept the point you make, and that would form part of that assessment. And if I hand over to Pauline in terms of picking up the CAMS.
Hi, thanks. Obviously we work very closely and continue to work closely with East Dunbartonshire, who lead the CAMS service and specialist children's services. So I think I heard 2 points in your remarks around understanding the need of the child being presented or referred. And there was some discussion certainly at last month's meeting around the referrers and giving more information to the referrers to make sure that referral that we receive gives the appropriate information to allow a decision to be made. In relation to the time to treatment, we do meet that target, but I appreciate for that ongoing treatment there is a wait, and you will see in the report that there's additional resources across the entire CAMS service across the board in relation to managing that and making sure that there's no real long waits in there, and also a relook at the establishment in Renfrewshire, which will be increased. So all of that will have a positive effect for the children moving through the service, which can only be a good thing. So hopefully that answers that.
Okay, that's great. Councillor Cameron.
Thanks, Chair. Excuse me. Yeah, I just wanted to talk a wee bit about the Audit Scotland report. We talked about it at the Audit Risk and Scrutiny Committee. It was focusing mainly on local government, but it did have a portion in it about the IGBs and the challenges that we face. And I thought it was positive that, although it's a negative, it's positive that that's there because it lays it bare for people to see. And I also wanted to quote Angela Leach from the Accounts Commission last year. I'll directly quote what she said. Integration joint boards can't tackle these challenges alone. They need the support of councils, health boards, Scottish Government and other partners to help them make the urgent changes that are needed now. Without this collaborative approach to change, the pressures facing integration joint boards will get worse. I just think it's really important to have that on record because the decisions we're facing are not decisions we're going to make. Yep. And we're all uncomfortable with what's happening. We've got people behind us who are unhappy with the proposals in front of them. And I just want to make it clear that we need help. And I want that to be put on record today at the IJB.
I agree with that. Thank you for that contribution, Councillor Cameron. Okay, any other questions or comments? Okay then, if we move to the recommendations, you'll see it's to approve the review and refresh of the existing IGB adults carer strategy for the extension of a 2-year to November 2027. And then the other ones are for noting, to note the key HSTP updates and to note any policy changes. So that's agreed, and we move on to item 5. Which is the financial report.
Okay, so today this is the final financial report for the year 24-25, and members are asked to note the position but also to approve proposed transfers to earmark reserves and approve the repurposing of reserves as well. So there's just a couple of areas. It is quite a detailed report that I just wanted to draw everyone's attention to. The final outturn for the year was circa 4 million, which is a huge improvement on the original forecast of the year, which is something that we've raised in the past few meetings with the IJB. So I won't go through the reasons for that, but it does reflect the work that was ongoing throughout the year to try and reduce spend as far as we possibly could. Then if you turn to the section on prescribing, which is section 6, you'll see there was a substantial movement in the prescribing projections from the original in October of nearly 4.2 million to a revised one of 3 million. And that reflects various areas within the prescribing budget, including reductions in price and changes to volume. And as you'll be more than painfully familiar, prescribing moves constantly. It's very hard to project it. It's very much reflective of national position and also any changes in supply and demand, and also the impacts of any war. The impact of the costs on supply really does it can have huge changes just on not just the price, but also the impact on getting the ingredients to make the drugs. So you need to be very cognizant of the fact that that can make huge swings in the prescribing budget on a monthly basis. But we do try and track that as well as we can, hence the level of detail that we do try and bring to yourselves. But it does move and it is a very volatile budget. But the position at the year end was far better than we thought it would be, which is very welcomed. Then if we go to section 8, which I do appreciate is quite complicated, and we've tried to simplify it as far as we can to show the movement on the reserves throughout the year. And you'll see in section 8.2, there's a table that shows the opening balance of reserves, which was just over 26 million, and the closing balance, which is 24. And that's because we have new reserves to carry forward, which were detailed in the paper, but also we've drawn down reserves throughout the year in line with the relevant prescription guidance. I think I'm a bit tongue-tied there, apologies everyone. So
What I would also highlight to everybody is in 8.4, we have now got significantly lower than we would wish general reserves. The IJB previously agreed to work towards maintaining a level of 2%. We're now sitting at 1%, which isn't a great position for the IJB to be in because our resilience going forward is significantly reduced. However, our ability to increase those reserves is also limited because those are our general reserves. If we look down, the general reserves have been reduced this year because we've had to pay the backdated pay for care at home staff, which has been roughly 3 million. That then leaves us with the 3.8 million going forward into future years. We then move into the next section, which is the proposed increase to reserves, and they're over two different elements: Scottish Government ring fence monies, and that relates to the normal monies, Action 15, school nursing, ADP, etc. And that's in line with the guidance from the Scottish Government, and also funding to carry forward on specific projects, and that's detailed in 8.6.2 as well. And then further on in 8.6.3, and I do know this is complicated, so apologies again. This is in order to deliver a balanced budget, we've had to identify reserves that can be repurposed because we haven't had to use them in year. We tried to use our existing revenue budget for that. So there's 1.5 million that we need to repurpose in order to be able to manage the budget in 25-26. So that is how we agreed to balance the budget in March 25 this year when we set the budget. So this is the mechanism to use that money and draw it down so it's available should we need it during 25-26. And obviously we'll do whatever we can to slow down spend during 25-26 to protect the reserves as far as we possibly can into the future. So that's all the detail I propose to discuss today, and apologies again for the complexity of the reserves, but I thought it's really important that we lay it out like that so you can see the detail. Happy to take any questions.
Thank you, Sarah. Well, as you say, that's a welcome out to our regards to prescribing. We weren't expecting that, so that is welcomed, as you say. Any questions, Mark?
Yeah, I've just got one quick question. In 4.1, bullet point number 2, it says review a direct payment client underspend and potential clawback. The carers are wondering, does that mean like the SDS money that's not spent, would that be taken back off them? Please.
Sarah, sorry, keep your mic back on.
Sorry. It depends. It's a combination of different things, Mark. Sometimes it's in relation to provider payments where they haven't delivered the service, so we can claw that money back. Sometimes it is in relation to SDS payments where a balance has been built up, which is really significant, and the money can't be spent for whatever reason. So there's a lot of discussion that goes backwards and forwards, and you look at the bank accounts, etc., to see why that balance has been built up. So it's a combination of different factors.
Okay, the one concern that the carers have is if that money is clawed back, which I understand if it's not spent, you're entitled to take it back. Don't have any issues with that. But will it affect their budget for next year? Because if they've not spent that amount of money this year, will it affect their budget for next year?
It tends not. It tends not to. A lot of balances were built up during COVID because people weren't obviously able to spend them. But in the past few months, the balances that have been clawed back are far reduced. But they would be subject to a revised assessment if their budget was going to change. So they would be part of that assessment process. It wouldn't automatically reduce their budget.
Okay, thanks for that. Oh, right, Councillor Hughes.
Thanks, Chair. It's a comment rather than a question. Firstly, I want to say that I think the movements of funds that Sarah has proposed seem sensible to me, and actually contrary to what she says around it being complex, it is complex, but the papers are really detailed and easy to read. Comparatively easy to read, I suppose, in terms of financial papers, Sarah. So thank you for that. I know you worked really hard to outline them. I suppose I also just wanted to note, when you look at things like the outturn and the variances in the various budgets, the kind of scale of the variances that we're looking at now and the amount of work the officers are having to do to manage that, they are certainly bigger variances than they were when we first became members of the IJB. They were already getting bigger from what I understand from Sarah then, but they're significantly increased now, and it's a lot of work for the team to do. So I just want to recognise the work that they do to manage the budget in here.
That's a great, Lisa. Thank you very much. Councillor McMillan's gets hand up, then I'll come to yourself, Max.
Aye, thanks very much. Again, thanks for your work, Sarah, on this. You and your team do a great job in terms of providing us members with the information, and we all know that finances can be a bit of a minefield for us lay people on the board. But I don't think we can let this go without saying what kind of precarious position we're in, and I think that it's fairly honest. You know, what I found in IGB financial reports is an honesty that sometimes you don't get in other places. We had a discussion yesterday at the full council meeting yesterday about IJBs, and it was the usual putting forward between politicians, as you'd expect. But once the dust had all settled, I think we all know that it's in a bit of a precarious position, the IJBs, and I know there's a COSLA meeting just about to start through in Edinburgh, and it's on the agenda today, and I'm glad to see it. And I think the politicians through in Edinburgh have to recognise the situation we are in locally, and there has to be a solution. Now, it doesn't matter. I couldn't care less who comes up with the idea. I don't care what party it is. I just want to see a solution, and I just don't want to see us ever going through what we're going through at the moment. I was a chair, and it's hard to believe it's nearly 10 years ago now I was a chair, and I don't ever remember outside influences being such a big factor. We never had a Ukraine war. We didn't have the rampant inflation. We never had the disaster of some of the budgets that were announced by the UK government and all the rest of it. We never had that to contend with. And I look back at those times with rose-tinted glasses, but it was a doddle. It was really, really easy, and it's really, really, really difficult now. So let's hope the powers that be, people who are way, way above our pay grade, realise what's going on there, you know, on the streets, so to speak, and do something about it and help us out. Thank you.
I wonder if it's okay. I think particularly given it's a public meeting, I know we've just heard about all the things we can't influence, but there are some things that we can, and I suppose I want to give a bit of a sense that there is some action, particularly in some of our private meetings, that don't necessarily flow through to the public one. And one particular area is prescribing. And we have spent a lot of time within the IGB in the partnership talking about what the drivers of prescribing costs are, and particularly with our GP colleagues. And I suppose it was just to tease out some examples of things that we are aware of. And it's not about restricting what medicines people are on, but actually working with the public and thinking about what's the most effective for them, making sure that they feel that they can request a review of their medicines and what's actually going to be most effective for them. So I really wanted to just tease out that even within that, we're not just taking for granted that these costs need to continue, that we want to make sure that prescribing budgets are effective and it's actually having the best impact on people. I see Stuart wants to come in, but it's really about that working with the GPs, the community pharmacists. There's things in there that we are doing and working quite hard on. So I just really wanted to make that point.
I appreciate that. Thanks, Max. Over to yourself, Stuart.
Yeah, and I think a large part of the reduction in the overspend, and I think the reality is we're not going to see no matter how much work we do, we cannot mitigate the increased inflationary costs in medicines. It's just not feasible. But I think what we're trying to do is reduce the overspend and trying to mitigate any increases, and that a large part of that 1.2 million reduction, you know, you're seeing an average cost per item reduce is unusual. You think, you know, at the moment that in itself is quite positive and is a direction of travel we'd want to continue. But a lot of that is work that's done by the central prescribing team, colleagues in finance at the health board, to identify drugs where there are similarly effective or more effective alternatives that are cheaper, and taking quite a lot of time and effort to swap those patients onto those drugs, have conversations with patients where there's a clinical necessity to do so. So all of that takes a huge amount of time and effort, and the team from the pharmacists, the technicians, the GPs, the other prescribers, non-medical prescribers have all done a really, you know, sterling job to get us to that point. But I also think it's great that when we have these conversations with colleagues and elected members, that that there's a willingness to support the work and give those messages to our patients and the public, who have also have to be supportive of this, because ultimately I think the message really is to patients, we're doing this because every pound we save on drugs that we could spend on something else that is cheaper is a pound we don't have to save from other parts of the budget. So I think that's a really key message, and having the support of the public and colleagues across the community is really important to help that work, because it isn't always easy when you're asked to do something differently or change a medication you've been on, or even stop a medication that we no longer think is effective and cost effective in doing a job that is necessary.
Our thanks and appreciation go out to all the team, sure, because it's a remarkable outcome, so well done. Right, so if we can agree the recommendations then on page 37, I'll just run through them. So to note the year-end financial position 24-25, to note the use of earmarked reserves to deliver a break even in section 8.4, approve the proposed transfer of earmarked reserves in section 8.6.1 and 8.6.2 of this report, and approve the repurposing of the reserves in section 8.7. All agreed? Agreed. Okay. That takes us on to item 6, which is the unaudited annual accounts. Easy for me to say.
Okay, thanks again, everyone. So these are the accounts for 24-25. So the accounts are supposed to tell a story really of how resources are used throughout the year. So these are a summation of the 24-25 story of how we've used our resources. It also refers to our strategic documents and summarises the year-end outturn position for 24-25, which we've just discussed in the previous paper. Now, I know not everybody finds accounts really fascinating, unlike myself, so I won't go through every single page, but there are a couple of things that I would like to draw everybody's attention to. So firstly, if you could go to page 34 of the accounts, which is page 102 in the papers. And that's just for information. It's just a reconciliation, just to show how we get from the year-end outturn, which is roughly 4 million, to the roughly 2 million movement in reserves, which is the key figure in our comprehensive income and expenditure statement in the accounts. So that's just it's just for information, because sometimes people want to know why is there a difference? That explains the difference, and it's due to statutory accounting entries that we have to make. So that's really just to explain that. The next page that I'd like to draw your attention to is page 53 of the accounts, but page 121 of the papers. And this is part of the annual governance statement, and it's just for assurance for everybody. This was approved by the Audit, Risk and Scrutiny Committee last week on the 20th of June. And the very important part of this is the last paragraph on that page is the internal audit opinion, which is concludes that they can find great assurance in the controls that are in place within the partnership. So that's a really vital piece of information for the accounts. And then finally, on page 63, page 131 of the papers, it's just to draw your attention to the conclusion on the going concern position for the IGB. So this is really important, because the going concern status is important to members, because we should note that the accounts have been prepared on that basis, but it also highlights the fact that there are pressures going forward. So the position for us to remain a going concern remains highly pressured. So it's just to highlight that for the current year, we still remain a going concern, and for the reasons that are outlined in the accounts. So that's all I was going to highlight today, but happy to take any questions on the accounts, which are the unaudited set.
Mark.
Thank you for this report, and I'm pleased to see in the report how the Carer Centre and HSCP are working together to launch the Renfrewshire Carers discount card. I think it was great that we all worked together on that, and I look forward to seeing more businesses signing up to it, because I think that's helped carers and the community as well. I've been asked to ask one question, and that's in Appendix 1, page 14, page 82 of the papers. At the top of the page, it says, in addition, at their meeting on the 19th of February 2025, Renfrewshire Council Leadership Board approved the non-residential social care charging policy for April 2025. Should deliver increased income and the IGB criteria of 6335K. The question I've been asked is that all the money that's going to be collected, or is that just the IGB share? will the council be keeping some?
Sorry, I still had my light on. Apologies, Mark. All of the money that comes to the non-residential charging comes to the IJB. All of that income. So that's the increase in income. None of that is retained by the council. It's the council's charging policy because it's not devolved to the IJB as part of the legislation. It wasn't devolved, but the actual income sits with the IJB. And it will go towards funding services.
Any other questions or comments? No, so nothing online. So we're okay to agree the recommendations on page 63. Agreed? Agreed. Okay, item 7 is Sustainable Futures Update.
Yeah, that's myself. So this paper provides a further update on Sustainable Futures Programme activity to take forward the recommendations that the IJB agreed in December 2024. In addition to this, an initial updates provided on transformation considerations, recognising the continued pressures, financial pressures over the medium and long term as outlined in the medium term financial plan, which the IJB recently approved. Since the last update to members in March, work has continued on the development of integrated impact assessments for all proposals. Within this period, there has been a key focus on the savings where further service model design is required and also wider engagement. And this is to allow us to develop proposals to bring back to the IJB for final consideration in September. In section 4 of the report, we set out the robust process taken to develop and test each integrated impact assessment as previously agreed by the IJB. And it also notes the substantial focus on proposals which required an element of service redesign. In particular, we highlight the 2 proposals relating to day services, where in advance of the public engagement process, we established focus groups with staff and also carers and families to test and inform the proposed design, which would form the basis of the draft impact assessments. While these sessions were understandably challenging, we received positive feedback from attendees about the chance to contribute at an early stage and also the format of the sessions, in particular the videos that we developed to set out initial thinking. As previously reported, the public engagement process commenced on the 2nd of June, and this will run to the end of the month, seeking views on the proposals which would directly change current frontline service delivery models. The engagement approach was informed and tested by discussions with the Carer Centre and also our IJB Carers Rep. And that included elements such as the registration and feedback forms, the schedule of engagement activities, and also the format for both the in-person town hall meetings and the online sessions. In advance of the engagement process launching, our staff within the affected services were briefed on the impact assessments. We also gave an opportunity for service users and carers within those affected services to be given early priority access to register for engagement events. And we sought to raise awareness of the engagement process as widely as possible. When the engagement went live, a full draft impact assessments were published for each proposal, along with easy reads and also summary versions with the audio similar to what folk had found helpful during the focus groups. And we also provided a range of other supporting information. The engagement sessions have now concluded, where we had around about 150 attendees of the 185 that registered for these sessions. Staff and some specific service user sessions are still taking place, so that will continue. And we also will continue to welcome online and paper surveys until the end of the consultation period. So the feedback from this engagement period will be reviewed and it will be reflected in the final integrated impact assessments, which will be presented for consideration when the IJB meet in September. And wider work to develop and progress the recommendations in relation to the other savings agreed by the IJB in December is continuing alongside this work. So it's just, I think it is worth highlighting that the savings that are being taken forward through the
public engagement are only a subset of the wider savings that we are taking forward and that the IJB agreed in December. Section 6 of the report highlights the programme risks, and the majority of these have been highlighted in previous updates, so members should be familiar with them. There is one new risk that I would highlight, and it relates to capacity challenges within our support services to progress the breadth of work ongoing. An example of this is our change and improvement team. And due to current absence and staff turnover, there's real pressures in that team. And they're really central to supporting our operational services with the service redesign, programme management, such as planning, risk management and development of the impact assessments. And also on the back of that, as highlighted recently at the Audit Committee, our staff side and trade union colleagues are also experiencing challenges with the volume and pace of programme activity. The final section of the report looks ahead, recognising the need to fundamentally review the way the HSCP operates in the longer term to ensure sustainability. And this really aligns very much with the direction set out nationally by the Scottish Government and also being adopted by both partner organisations, Renfrewshire Council and NHSGGC. And this recognises the need that we need to have more focus on transformational thinking with priority on prevention, early intervention, digital technology and service reform, and that this should take a whole system approach where possible. However, service modernisation takes investment and time, and this will need to be progressed alongside a continued focus on savings to ensure that we can deliver financial balance in the short term. So the SMT has commenced initial planning discussions. However, central to these are going to have to be how we manage to maintain service performance, deliver on savings that have already been agreed, identify further short-term savings while progressing a programme of transformational change. So more detailed reporting on these discussions and our thinking will be brought to future meetings of the IJB. Thank you.
Okay, thank you, Frances. Any questions? Oh, it's great for you. Right, Max.
Thanks, Chair. Thanks, Frances, for the report. I mean, there's a huge amount in that, but I suppose at this point, I just wanted to say, first of all, thank you to everyone who ran the sessions over the last few weeks. I thought they were well run. I thought it gave a lot of opportunity to meet and discuss face to face, but probably a bigger thanks goes to all the members of the public who came along, because I know it's quite daunting to come along and lay bare what your worries are and how you're feeling about very personal aspects of your day-to-day life. So I get a huge amount from it in terms of my questions that I've raised, and that, if anyone was in the tables I was at, I was often saying, can we make sure we pick that up and follow it through? So really helpful, and actually really appreciated everyone's honesty with me and being very respectful to me as an IGB member. So thank you to everyone who attended.
Absolutely. Okay.
Thank you for the report. In as much as I'm just here as a proxy, I wonder if you could explain the timescales to me. Your proposals you finished the engagement session. The proposal then come back to the September meeting, if I'm correct there. Are these to be the idea to be implemented in the next financial year, 26-27? Basically, the reason I'm asking that is because you're already flagged out your reserves are in a pretty perilous state, quite frankly. I think you're forecasting a deficit for the coming year.
Yeah.
Just timescales.
I can pick that up. There's a range of timescales, so they're not all aligned to the same timescales, and you'll see in the impact assessments the delivery is over for some several years and others are immediate. But alongside, as I'd mentioned before, the proposals that are subject to public engagement, there are a number of proposals that were agreed for the SMT to progress through internal governance to deliver in the shorter term. So there's not one specific timeline for these.
Mark?
Thank you for the report, and can I thank all the staff and the volunteers that took part in all that. That was very welcome. And I'd like to thank the voting members for actually coming out and hearing the carers. I understand carers have a busy schedule and I wish more had attended. I'm still concerned about the proposals because I feel there's a missing page. What if this was to be voted through, what comes next? And as you can see today, we've got lots of carers outside trying to make their voices heard. So I want to try and show how they perceive what comes next would look like. I understand you haven't voted it through, but there's a scenario out there that they think this is going to happen, that you raise the vote and it goes through and then the families are left. So I'm going to use an example of a mum and a daughter. So, okay, mum says to the daughter, okay, they've made changes. You've got to go to a new building and a new times table. So that service user, say, is Emily. She goes to the new building. She's going to walk in. Oh, different smells, different building. Where's the toilet? When am I going to go? Who's this person talking to me? Then they're going to go home. They're going to escalate and say to the mum, the carer, you know, you said it was going to be all right. I had all this stress. But don't worry, we have a plan in place. The IJB's put their strategic plan in place that we can follow and go out in the community. Okay, so next day we go out, we walk up to Autumn Connections. Great service. They help people with finances and getting job. We get there, the door's locked. So what do I do next? You know, the service user is going to be really hyped up, go home, have a row with the carer. Don't worry, there's flexi care in place. Go to that building, the door's shut. Don't worry, I know you're getting to near the hospital stage, but we've got outreach who are doing wonderful things. They've got nurses going to London to enter competitions. So they have a great service. We get there, the door's locked. And then the service user is going to be like, Mum, you said you were going to help me. And the carer is going to be like, well, I've had to give up work. I'm following the strategic plan. Everywhere's locked. I went off this planet. That's the reality why people outside are concerned today. That's how they perceive if this vote goes through will look. So I understand it's not voted through yet, but when the decision's been made, obviously it will then go to the IJB development session and then go to the things. That's August, and then 6 days, the carers then find out what's happening. Is there any chance maybe that we could get some carers, voting members and HSCP staff, maybe something like at the carers centre before the development session and put it out there to them? It's just an idea.
No, definitely. I mean, they need to be aware. We need to know exactly what it looks like, what a day in the life is going to look like. So that will all be prepared. I'll hand you with Francis, but that will definitely, we won't be in the dark, Mark, with regards to what's on the programme and what's available. So Francis.
Yeah, absolutely. And I suppose as a degree, and not to minimise that we recognise that any disruption to a lot of these service users can be exceptionally challenging and upsetting, but in Renfrewshire, we do have a really strong track record of implementing change. And I think the recent example of the closure of Montrose Care Home was testament to the work and planning that not just from a management team, but with our staff who were also going through change, how they supported both families and residents through that. Our timelines incorporate stage 2 of the work that we are doing after the IJB decide on the proposals will be very much focused on that implementation and how we do that, and ensuring that our timelines take into account the client group, their needs, and how we can support those change. And that will be done in terms of the individual needs of folk, and we've got experience of that and looking at friendship groups, and we recognise that there's specific needs. Also appreciating where services are continuing, but the buildings are changing. We recognise that some of those buildings will still need work to actually be sort of set up for a different client group, so that would need to happen too. So nothing will be happening overnight in terms of moving people to new services. And I recognise in the examples that you set around about where services are closing, and there is a real focus there with members of my team who are looking at alternative supports out there, and I'm not presenting that as full mitigation for closure of services, but we take seriously that duty to support people where possible, look at other community options and what else that we can do, and if those individuals need a review or assessment to carry that out. So whilst we might not be able to give assurance around specifics of individuals, we'd be more than happy to come along to the carer centre or anyone and just talk about the things that we will factor in, how we will support folk, and provide some sort of reassurance that this wouldn't be something that would just happen overnight. So I hope that provides a degree of assurance to you. Thanks.
Thanks, Frances. I would just like to thank as well all the service users and carers that have attended these engagement sessions. And it just came to my mind there that there were a family, obviously parents, and they were concerned their child was attending Mirren. So obviously that was in the lagoon and the change would come. So what they were concerned at was that the friendship groups weren't going to be allowed to be kept together because they thought we were going to base it in a kind of geographical kind of base, depending where you live. You know, somebody told them depending where you live will determine which centre you go to. And what they were asking us to say is that instead of basing it on a geographical basis, please base it on a friendship basis, because that's what makes our day, you know. So that's something, these things will definitely need to be the forefront when we're actually, if the proposals go ahead and if they're looking at putting them to different centres, then these are the focuses that keeping the family, keeping these friendship groups together, because that's what means everything to them. And what they were concerned about was these friendship groups aren't necessarily of the same capability. So they were worrying that they would get put into brackets of a capability, therefore their loved one would never see their friends again. So these are things we've got to keep in the forefront of our minds. But as I say, these engagement sessions, you know, I mean, they're heartbreaking for a start, you know, because you see that not only do we have an ageing workforce, we've got ageing parents, ageing service users. You know, your parents are in their 80s, service users in their 50s, and you can see that you worry about unintended consequences. You know, you worry about parents just not being able to cope, you know, and you could see this, I could hear this in one of the service users. She'd been looking after her sister for 40, 50 years, you know, and she was concerned that she could no longer do this on her own, you know. So we've always got to have in our forefront of our minds what the proposal is, what the saving is going to be, and what the unintended consequences of that can be. So that's something we must never lose sight of, because, you know, turning up in acute is not going to, it's not what we want. So, Ian McMillan, I see your hands up.
Thanks again, Chair. Certainly, I was at probably most of the meetings online and in face, and I must admit I took an awful lot out of them. There was a couple of services I didn't really know too much about, Autism Connections, and the last one I was at was a Assertive Outreach, which I found an absolutely amazing service. There wasn't any service users as such at that particular meeting, it was staff. But I thought that was quite good because I got a really good idea of what they actually do. Now I'm not going to get into the ins and outs of what we should do and all the rest of it. That will take care of itself. We've got other meetings coming up in the coming months to talk about that. But the engagement service engagements I thought went very well. The ones I were at, I thought they were well organised. I thought we were left in no doubt by the people at the tables what this was all about. I can understand some of the people who were there, their frustration, because people maybe didn't realise or understand what it was all about. But I think from my point of view, I think it's job done in terms of hearing firsthand from people who would be potentially impacted by any potential changes in services. So I think that was achieved, certainly from our point of view, that was achieved. There was a couple of I can't even remember the exact word here. There was a couple of sessions, that's the word I'm looking for. There's a couple of sessions were cancelled because of lack of interest, which I was found disappointing, because I was wanting to hear firsthand from people who use these services, but they, you know, we can't force people to attend things, so that was slightly disappointing. It's maybe something I'll follow up a later point. Certainly there was one issue raised at one of the FlexiCare sessions I was at about the numbers of people who actually use FlexiCare. That was questioned by someone who used to use flexi-care, and it's maybe something I'll take up separately outside the meeting, because it's unfair to bounce a question at a meeting, I think. But I think overall, I think it went very, very well. It's a very, very emotional subject, and that came across, and sometimes it was quite harrowing actually to listen to people talking about it. But as I say, well done to the staff. I thought on the whole it was very well run, very, very well handled. And if anybody's in any doubt about the whole process, and as one of the voting members, I have certainly got a much better understanding of these services, the impact they have on carers, service users and their families. So if that's all it was meant to achieve, it has been achieved. And I'll certainly be going to that meeting in September much better informed. Thank you.
Thank you. Thank you. So, Councillor Cameron.
Thanks, Chair. Yeah, just similar comments that have already been made about the engagement sessions. Apologies, I couldn't attend on the in-person ones, but I wasn't very well, and I didn't want to pass my germs on. But I did attend online. And again, as Ian said, very emotive. But I just wanted to acknowledge that this is kind of Groundhog Day for a lot of people, because they've been through this last year. And I want to acknowledge that it's been pretty grueling for them to tell their story again and make their case again. So I just wanted to say that we understand that and we appreciate that. But as Ian says, we are more informed, and it's really important that we hear people's individual stories and their experiences. So I found, again, that I got a lot out of it, and I just wanted to thank everyone involved. Thanks.
It definitely does help us be more informed. You know, I never managed to attend that previous one, but Jacqueline reiterated what had been said, and this is tremendous work, you know, but we can go back into that a bit more at a later date. Councillor Hughes.
Thanks, Chair. I'll be relatively brief because I would be repeating what my colleagues have said generally, but there were a couple of things that struck me in particular, and those were things around. I thought carers and individuals engaged really well with the what if of the question. So if the decision was made to do it, what would that mean for us? And there were things around things like timing of the day for doing things in the mornings and things that aren't particularly detailed in the impact statements, but that I think you and I, for example, completely understand what that's like as people with disabilities ourselves. And there were other things around, you know, as you've said, impact on older carers particularly, but also carers who work, because that's an element of their life, impact on individuals that may impact on health and behaviours, and how that impacts in the wider family. And these are all things that I've experienced a bit professionally and also personally, because I've been a carer myself and I've been a professional carer. But I think when you hear people's individual stories, it really highlights the complexity of it and how we have to continue to work with people. And I suppose one thing that came across to me was people were concerned about the immediate disruption, but it's also the kind of not knowing. So I really welcome that agreement that there would be some discussion with the carer carer centre and us and others, if we can be, just around not specific people, but what the timescales might look like, because people don't know what they are, and that's causing anxiety. And that's some of that is just that it's part of the process and we have to work through things, but I think we should reduce that anxiety where we can. And I would just say again, I mean, I attended a lot of the sessions and I would thank both the staff for working through them, because as you said, no one wants to be doing this, and also the carers and people that we support who came along, because it really is invaluable to hear your perspective. And you do have to keep telling us this, because this is how the processes work, which is possibly something we have to work on. But I appreciate and respect that you've come along to contribute.
Thank you, Lisa. You know, I acknowledge the fact that, you know, change is difficult for anybody, let alone throw in a disability or any sort of learning difficulty. But what I certainly, oh, my mind's went blank. So I was going to say something that came up in the engagement session there. But God knows, my mind's went blank. Not Tony. Kath.
Thanks, Chair. Yes, just to echo other voting members, having been at a couple of the in-person sessions, it was just tremendous to have the chance to sit with people and to hear people's experiences and the impact that changes in services would have. I'd like to pick up on Francis's point about the capacity and capability risk.
Yes.
I'm hearing that very, very strongly. And given the, the transformation programme and the recent flurry of documents from the Scottish Government, what I'd love to see in this IJB community is to build on that willingness of people and the community engagement to be part of those transformation conversations. 7.6, Francis highlights that there's early scoping of a set of principles to inform that future work. And I would hope to see that real community engagement is a strong part of that.
That's great. Thanks, Kath. Any other questions or comments? Mark first. Mark. Sorry, because you're online there, Mark.
Thank you, Chair. A couple of things just in reference to staff. First of all, Unison has issued a statement in relation to the proposals, which were made public, and I've made you aware of them, setting out our position. And I think in terms of, the staff at Montrose were referenced in the part they played in the transition for the clients, and I think whilst that, that was a kind of small unit, and there was other negotiations ongoing for the staff at that time. I think that we need to understand that if the proposals are voted on and go through, will be a significant period of change for the workforce, and they'll be going through quite a traumatic time themselves if the proposals are implemented. We're already being contacted with staff, and they're quite emotional because some have worked with client groups for many, many years. And have concerns about what's going to happen to the client groups, as well as, and quite often before what they think of what's going to happen to themselves in this. But Unison will continue to provide support. And we've also approached the council about discussions about if some of the changes go through and the criteria is applied for accessing services in the way that we've seen reported, then our concern is about knock-on to the services that are provided both at the council and at the NHS, about having capacity to pick up some of those vulnerable people coming forward, or disabled people coming forward for assistance, because we need to make sure there's still a statutory duty on those organisations to provide care in our community, and I think that we need to make sure that everything dovetails properly for the smoothest transition possible. But obviously, Unison's position is to support its members, but also represent our community, as we're part of the community, and we'll continue to do that, Chair.
It came through so clear at the engagement session that how well respected and loved the staff are, and it was one of the major things they were saying, especially when circulating around the Disability Resource Centre. There was individuals there saying they had all sorts of kind of physical problems and problems just, kind of being able to get their point across. And what they were saying, the chap was saying to us, was it takes quite a long time, maybe years, for the staff to actually understand what I'm saying. Now, I'm comfortable with the staff at the DRC. I've been there for 20 years. They understand exactly what I'm saying. And if you're telling me now that we have to go elsewhere, if you're providing the anchor, I don't like it. He says, for by that, you need to reassure me that my staff can come with me. He's got a PA, but the retention of the staff in the building. So that's something that Mark came back so clear through the engagement, how well thought of, the unsung heroes that they are. Okay, is there any other questions, comments? Okay, then we'll move to the recommendations in item 7. Just the bottom of page 149 and the top of 150. So if we can agree the recommendations, move on to item 8, which is the draft annual performance report. Is that yourself, Francis?
Yeah, thanks. This paper presents the 24-25 draft annual performance report for IJB approval. The full report can be found as an appendix to this paper, and it sets out the end-of-year position against both the objectives for our strategic plan and also against our performance scorecard. It's structured in a similar format to previous years around the 5 themes in our strategic plans. So within each theme, we highlight alignment to the national health and wellbeing outcomes, progress towards the relevant strategic plan deliverables, and also key performance achievements of each theme from the scorecard using RAG status. And importantly, we also provide case studies and around positive initiatives and work related to the strategic plan and also performance. And I think these are really effective at illustrating the good work that we're doing across Renfrewshire in our services and with partners through visuals and stories of impact. The report also updates on the strategic plans enablers, so that's things like workforce, finance, digital, our housing contribution statement, and our hosted services, podiatry and primary care support. Overall, this year's report reflects the HSCP's strong performance within a significantly challenging environment, where we've seen an improved performance in our scorecard position against last year. So we have 8 indicators where the performance has improved, and also, and importantly, we've maintained performance for 18. And as we've noted in previous updates, maintaining performance in the current climate is increasingly difficult in recognition of the resource pressures that we've been talking about today, and also the increasing demand and acuity of need that we're seeing. We also show steady progress against our strategic plan, with 76% of our Year 3 deliverables on target or completed. However, resource constraints have meant that we have had to reprioritise some objectives that were in our 22 to 25 plan to allow us to continue to deliver our services at the current high standard, alongside the Sustainable Futures programme activity that we've been discussing. So any of the objectives which have either been paused or not been progressed have now been reviewed, and where appropriate, they're getting picked up within the refreshed strategic plan, which David will pick up within another paper at this meeting. Just to pick up on the cover paper, it provides a summary overview of our end of year performance against both the performance scorecard in sections 4 to 8 and then the strategic plan in section 8. I don't plan to go through the full APR or the cover paper, you'll be glad to know, but there are just a few things I would highlight. In relation to the scorecard, I'd highlight improved indicators in 4.6, particularly where we've reduced by 9% emergency admissions from care homes, and also our figure for the number of new carers reported by the carer centre increased by 22% from last year. So that went from red to green status, which is a huge achievement. And also we've seen improvements in our waiting times for psychological therapies and primary care mental health team. However, as outlined in section 8 of the report, our 2 staff absence indicators and A&E waiting times continue to be challenging, and that was the case last year too. And also the number of adult support plans completed for carers has declined, so that's new in this year. So it's quite interesting that while we've supported a lot more new carers, less support plans have been completed. So that is something that we're doing further work to review. There are also many achievements to be proud of in relation to our strategic plan. As mentioned already in this meeting, maintaining our position as highest performing HSCP in Scotland for standard delays for the 3rd year running. The launch of the short break service for unpaid carers in March this year. Recognition from Public Health Scotland on our alcohol and drug partnerships, year-on-year sustained improvement for medication assisted treatment standards. So often people would know that as MAT standards. The implementation of initiatives such as the Thrive Under 5 pilot in Johnson, working really closely with our partners, the implementation of emergency infant formula pathway, and it's important to note also the really positive outcome of 3 care inspector inspections. So as we move into 25-26 reporting year, we remain committed to delivering high-performing services and also delivering on the improvements set out in our refreshed plan, strategic plan, which we'll go into. However, and is covered already in many of the items in discussions today, it is evident that the wider operating context and focus of resource on saving proposals will continue to impact the breadth of activity that the HSCP is able to deliver, and also potentially the performance of some of the indicators within our scorecard. So in advance of the IGB in September, we will bring a revised scorecard with the targets alongside a delivery plan for the strategic plan, and this will be taking account of our capacity and looking to present a realistic and pragmatic way forward. Thanks.
Thank you for that, Francis. As you say, many achievements and much to be proud of, especially given the current financial pressure and the landscape these are all working under. So excellent, thank you. Mark.
Can I thank you for the report? This report got me thinking. There's so many times I struggle to find positives in what we're doing. And this report made it so easy. I mean, as already mentioned, we got short breaks for carers, Ren Talks raising our teams, digital buddies, which is for the older generation, which I was surprised to read about. And they're getting involved in the digital side of it. But also, as we mentioned, the adult carer support plan. I'll put my teeth back in. It's helped so many carers. I mean, I know one case where the carer went to the carer centre, they got an adult support plan. That then opened up the door to go to the support groups. They then got a ticket for St Mirren football ground.
Oh,
they took the.
Oh, depressing.
Hey, they got you up last year. Then the carer enjoyed it, and the service user enjoyed it, and then St Mirren worked with that child and got him out walking onto the pitch, meeting the players, walking out with the players, and that all came from an adult support plan. So I think we need to find a way that we can actually promote the success stories.
Yes.
It's easy to find the negatives. We need to find a way to promote the success stories.
We're actually not good at that. We're really not good at promoting how well we are doing, you know, and there's so many aspects that we do. We're doing incredibly well at, so that's really positive, really good to hear. Thanks for that, Mark. Kathy.
It's just the same comment, so I'll be brief. But it was just to say, yeah, obviously in the last item we're kind of looking at doom and gloom and worrying about our financial situation. But this has perked me up a bit, and so lots of good examples there. So just same comment and well done to the staff. I think the staff awards are great as well to celebrate the achievements of the staff too.
Absolutely, absolutely. Right, that's great now. Oops, sorry. Right, Alice.
Thank you, Chair. Yeah, I wanted to echo that it's great to see the contribution of the third sector noted in the report and the significant impact that the work that they're doing is having. I just wanted to ask if one point could be clarified. This is it's on page 247 of the overall papers. It's page 74 of the annual performance report. It's just in relation to the whole family wellbeing network. So there's under CF5, under the year 3 deliverables, it says the whole family wellbeing network established using third sector interface. And then it goes on to say funding extended, and they are evaluating current position. I just ask if that they could be clarified because it's a bit confusing. The TSI doesn't manage that fund, so it's not within our gift to evaluate it. We sit on the steering group and support it, and we did support the establishment back when it was first announced. But just if that could be clarified when this is finalised. Thank you.
Okay, thanks for that, Alice.
Yeah, we can make that amendment and clarify it to make it clear that it doesn't sit with Engage. Thanks.
Okay, no more questions and comments. So that item's agreed. So that takes us on to item 9, which is the refresh strategic plan, 25 to 27, pages 273 to your pack to 376.
Thanks, Chair. So I'll just give a brief overview of this paper for members today. So the paper itself covers the final version of the Refresh Strategic Plan 2025-27, and it seeks IGB approval for the plan. The paper sets out the process that officers have followed to consult with prescribed consultees on the draft of the Refresh Plan. And in section 6 of the report, we also describe the feedback that we have received and in most cases have reflected within the plan. Where we received comments that were not included in the updated plan, we've explained the reasons for this also. The report includes examples of the positive feedback that we gathered through the consultation process, which shows that the layout of the plan and content has been well received, with particular comments received in relation to general practice and unpaid carers. The decision to refresh the plan rather than create a new one was also broadly welcomed. The most material changes that we've made have arisen through our consultation with NHS Greater Glasgow and Clyde and with Renfrewshire Council, and that has resulted in enhanced references and linkages to wider system and digital transformation throughout the plan. We've also responded to feedback from the Council that adult protection could be more clearly articulated within the plan by updating the previous enabled futures themes, which is now known as supported futures, as we feel this better reflects the ongoing focus that we have on adult protection, and also follows on from the very positive
inspection results that we've had recently. In respect to that change, we've also added an additional principle to the plan, Principle 1, which is to reflect that all of our services seek to keep people at risk of harm safe and protected. In the context of the changes that we've made, we have noted within the refresh plan that we view it now as a bridging plan, which will take us towards a longer term plan with a greater focus on transformation, which will be developed for 2027 onwards. We've also included an updated version of the medium-term financial plan as Appendix 2 to the paper. The MTFP was approved by the IGB in March. However, it's now been updated to reflect the 4 confirmed themes that we have in the refresh plan, alongside some other minor changes to terminology. The IGB is also asked to approve this updated version today. Should the IGB approve the updated strategic plan, an EQIA will be published on the HSCP's website, and the plan will be shared with our partner organisations with a description of how their feedback was reflected. An annual delivery plan, as Francis has mentioned, will also be developed and will be brought to the IGB for approval in September 2025. Thank you.
Okay, thanks, Matt Davis. Any questions or comments? Yes.
I feel like I've done a lot of talking today.
Aye, I'll look straight to you now, Mark.
Can I take the time to thank for this report and praise all the work gone on behind the scenes with the staff. It's great to see the carer centre, planning groups, unpaid carers, service users all coming together to produce a strategy.
Yep.
I do have one worry though, negative again unfortunately, is we've got this wonderful strategy that everybody supports, and then we've got the Sustainable Futures programme. And in my view, that Sustainable Futures programme tears up this strategy, because that Sustainable Future programme goes against everything this strategy stands for. So I've got one question to the board: which is more important, the strategy that works or a sustainable future that doesn't?
I would call it between a rock and a hard place. You do see it through the reports. It's difficult to deliver this review plan, considering the transformation we're currently going through. That rolls through all the reports, Mark. So it's a difficult situation without doubt. But in an ideal world, but any other questions or comments? No. Oh, sorry, David.
Yeah, just to come back up to your point there, Mark, because I completely appreciate that tension between sustainable futures and the strategic plan is very real. What I would say about the strategic plan is that we do understand the objectives that the Scottish Government want to achieve for health and social care, and we do need to reflect them within our planning, and also reflected that the last plan was in 2022, so it was a number of years ago. But I would say that we've sought to develop a plan that's pragmatic, and it does reflect those financial challenges throughout the document. And I think it's important to note we have reduced the level of ambition within this plan to reflect that wider circumstance. And it's only for a period of 2 years, which does give us the opportunity to understand in more detail the impact of sustainable futures as we go along. I think in reality as well, when we talk about a plan from 2027, we'll be starting work on that in the next 12 months. So it is really quite a short timeline that we're working to.
Thanks for that, David. Councillor Cameron.
I just wanted to say that those comments from David were really helpful, because when Mark asked that question, I was kind of stumped. But I think what you said is really, really important, that the ambitions have been scaled down. So I think that's helpful for us as a board to realise that it would have been a very different strategic plan otherwise. So thanks for that, David.
No, I appreciate that answer, David. I read it in your report, but I forgot it, so you mentioned it again. Right, that's great. No other questions or comments? Okay, so we can agree the recommendations on page 273 and that are continued over on the top of 274. And then we move on to the annual update of delivery of NHSGGC primary care strategy. Fraser.
Hi there. Can you hear me okay?
Yes, Fraser, we can hear you fine.
Hi there. So firstly, thank you for inviting me along to present on the primary care strategy, and some of the conversation that's just taken place is relevant to this as well. So by way of background, as a number of members will be aware, we launched the GGC primary care strategy in April last year. And as part of that, the Health Board requested an annual update, which is included within your pack today. A few key points that I'll kind of pick out and then pause for any questions or comments. The strategy itself was one of the first in Scotland and sets a long-term ambition to ensure that primary care is at the heart of health and care across Greater Glasgow and Clyde. There's a number of high-level ambitions within the strategy that include developing a sustainable, staffed and skilled workforce, a step change in data and digital technology, integrated care and improved system-wide working, enabling patients to have an improved understanding of services, and ensuring that they access right services at the right time. There's also a focus on strength and prevention and early intervention, and better access to trusted information, and in turn the aspiration to reduce health inequalities. These ambitions of themselves, it's very similar to the previous conversation, are indeed stretching, and that is part of the reason why this is a 5-year strategy, and I'll come on to implementation moving forward at the end. More generally, the ambitions, thankfully, are in keeping with Scottish Government's recently published Health and Social Care Service Renewal Framework, and indeed Greater Glasgow and Clyde's own reform plans through Reform 25 and Transforming Together. We are, however, also realistic about the scale and size of challenge affecting primary care, including general practitioners, which was set out in Audit Scotland's March report that colleagues may well have seen, which particularly pulled out themes around demands on practices and services, financial challenges and workforce challenges. However, these things taken in the round, whilst provide challenge in terms of the operating environment, also provide us with a helpful structure in terms of moving discussions forward. Similarly, over the last year, there's been a lot of change within primary care. So I came into post in March, and my colleague Dr. Jude Marshall started as the Deputy Medical Director in April. So I think it's fair to say it's taken a bit of time for us to kind of get our feet under the table, but we're looking forward to working across all 6 partnerships, the Health Board, and indeed our independent contractors. In terms of more generally, through the strategy, there are 10 work streams with 5 particular priority ones, including workforce, digital, integration and interface, comms and engagement, and access. And there's been a number of areas of success in the first year that's set out in your papers. In terms of priorities for the next year, some of this, as I say, links to the previous conversation. One of our early priorities is interface and contribution to whole system working, recognising that no part of the health service works in isolation. And when we're looking across primary care, across all 6 partnerships, and as a board, we want to maximise the interface with HSCP's independent contractors through GP subcommittee and others, as well as our colleagues in the acute sector and the new interface division. We're also very keen to work with our colleagues in other health boards and Scottish Government, and that's particularly important in the context of yesterday's news, as some may have seen that SGPC and Scottish Government are now in formal dispute. So we watch developments closely there. And then finally, and this links back to David's point on the previous topic, over the course of the next 2 to 3 months, we are taking a bit of a step back in terms of making sure that we have more focused implementation on the strategy, particularly for the year ahead, so that our ambitions for 25-26 are proportionate and realistic, particularly given the model of primary care dispersed across 230 general practices and 6 health and social care partnerships. So in terms of the original paper to the GGC board, it was around noting progress against the primary care strategy, the performance around that, and the ongoing efforts to ensure that primary care is engaged with whole system working. So I'll take a pause there. Hopefully that's help to members, but obviously happy to take any questions or comments. Thank you, Chair.
Thank you, Fraser. I appreciate that. Any questions or comments for Fraser? Oh, Councillor Cameron.
No, it was just to say that John Miller's bulletin is always very helpful because things change so fast. So I only found out about the formal dispute this morning just before I read the papers, but it's just an example of how quick things change. But, so yeah, that's in the BBC News bulletin if anyone wants to have a look at it.
Right, that's great. Oh, sure.
Yeah, I just wanted to a couple of things locally in terms of work we've been doing that supports the strategy. We've had again recently our vocational training scheme, GP trainees job fair. So that's all the Clyde trainees across Inverclyde and Renfrewshire who would be coming to the end of their training, meet up with local practices across Inverclyde and Renfrewshire, which we work in collaboration with colleagues there. We've seen trainees actually be appointed into posts in Renfrewshire practices, which is fantastic because we know it's about recruitment and retention as well. I think we've got to flag some of the national challenges that we face, and some of these are out with our control. We know that the GPIT system, which is quite significantly overdue nationally, that is being reprocured, and there have been challenges in terms of the provider that was identified going into administration. That's clearly not something that we have any influence over, but we have to be honest, we're left with a system that is not really fit for purpose in 2025. Digital prescribing and dispensing, which should be a national programme to bring us in line with other parts of the UK, is delayed. So we're still using paper prescriptions, which really, again, in 2025 is the amount of time that could be released and efficiency we could achieve if we were actually operating in a similar fashion would be significant. And again, some of those conversations around accommodation, which we know we're working with health board colleagues, and I think the Audit Scotland report made it clear that there are challenges across the country around implementing one of the key tenets of the GP contract, which was that the health boards would assign the leases of all GP privately leased premises, which would potentially release capacity for health boards in terms of operating those in the way that health centres operate. So I think the challenges are significant, and I guess we had a really good event with our link workers, which are one of our kind of key elements of the GP contract that provides support to practices and do a brilliant job with patients. And they had an event yesterday up at the Wind Centre, which was fantastic. And they talked about the circle of control and how they use that when they're working with clients. And I guess with us in primary care, we look at the bits we can control and we try and do the best we can with those, and I guess try and influence where we can with kind of national and wider challenges.
Thank you, Chair. I always appreciate your updates. Any other questions? Gareth?
Thanks, Chair. Thanks, Fraser, for the report. I know the mention of the two strategies in particular. What caught my eye was around health literacy. So obviously health literacy is a key part of that, the plans around supported self-management. Yeah. But it also struck me that the earlier conversations around the budgetary constraints in relation to prescribing, that a good health literacy strategy where we involve local people in those conversations about the use of medicines. I wonder if you can say any more at the moment about the timescale for the health literacy plans.
Sorry, couldn't come off mute there. So certainly in terms of all our work through the strategy, we've got 5 identified public partners who are very active in terms of each of the work streams. And are contributing a great deal. In terms of the exact timescales, I don't have that immediately to hand, but I'll come back to you on that if that's okay.
Thanks, Fraser.
Thank you.
Thanks, Fraser. Any other questions or comments? Okay, we agree the recommendations. And that moves us on to item 11, which is the NHSGGC Unscheduled Care Transformation Plan investment.
Thanks, Chair. I'll pick that up. In terms of the report that's in the pack, you'll see that builds on previous updates to our IJB on the delivery of NHSGGC's Unscheduled Care Transformation and Reform plans. The plans and ambitions are being developed jointly with our NHSGGC partners, as well as the 6 HSCPs within the board area. Since November 24, the plan has been developed to deliver a whole system approach to improve unscheduled care performance, and that's been well documented within national media in terms of the impact of unscheduled care, and it's also got a clear focus on shifting the balance of care, so moving care from acute hospitals into communities where that's able to do so, and we've rehearsed some of that discussion earlier. In terms of the initial proposals, these were submitted from NHSGGC to the Scottish Government in early December 24. And following a process of negotiation, a final set of proposals and outline funding of £20.9 million was confirmed by Scottish Government to NHSGGC in April of this year. However, within that confirmed funding, the Scottish Government has cautioned that in-year funding might be withheld if insufficient progress isn't being made against identified performance targets. So we have got a very quick turnaround in terms of that improvement agenda. As part of the planning to progress the proposals and utilise the available funding, Chief Officers and Chief Finance Officers have been working very closely and at pace with partners across NHSGGC to develop a coherent set of proposals. The Renfrewshire component of this plan is based around scaling up already existing unscheduled care work, and in particular our Home First Response Service, as well as investment in intermediate care beds. The total cost of Renfrewshire's proposal is just over £576,000, and the NHS Board of Director of Finance has provided written assurance to HSCP Chief Officer and Chief Finance Officer, confirmed that the funding for these initiatives will be directed to the IJB and HSCP for a period of 12 months. And that is in the absence of certainty around future funding. In terms of IJB approval, what we're seeking is approval for that 12-month period only, and this is to ensure that no permanent costs are accrued against non-permanent funding. Should future funding be confirmed, a further report will be brought to the IJB, which will seek fresh approvals.
Okay, thanks for that, Karen. Any questions? Max?
Thanks for the update. I think this is, I guess it perhaps doesn't come out in the paper, but this is a real opportunity across the Greater Glasgow and Clyde area, of which Renfrewshire is a key part of, given the population size and the services we deliver here. As with my health board hat, and I don't often say that within the IGB, with this opportunity comes quite a lot of risk. And with that, and I say that because it's really important that we do deliver on this investment that's been made in this area, because I think if we can demonstrate the impact that these relatively large amounts of additional investment can make, then we're much more likely to secure it going forward. There are no guarantees in that, but it would, I guess, evidence some confidence in us as health and social care partnership organisations in terms of being able to deliver change, and that will only benefit the people in the local area, whether they're using health services or social care services, because it will keep people healthier, hopefully in their homes or close to their homes. So I really just wanted to draw that out, that this it comes with great obligations with this additional investment, and there are no guarantees going forward. But there are huge amounts of effort going into ensuring that every level of impact that we can make with this money will take place. So I'll just pause at that, but I just wanted to draw that out because I'm not sure, it doesn't always come across in the words.
That's great, Max. Thank you very much. Paul?
Thanks for your report. I wonder if we could pick up on one of the things about the hospital at home services, current numbers and so on there. You said in the GGC one they're looking to get 50 beds in the first year. Renfrewshire is obviously one of the pilots. I wonder if you give us an update how it's doing and what the sort of numbers are and how feasible it is. And following on for that, it says in your paper funding's not being agreed to allow confirmation of the bid. So any update on that?
Can I bring Pauline in, who's actually leading on our hospital at home? It's a very recent development for Renfrewshire, so we can only report back on the very beginning stages. But Pauline, could you pick that up?
Yeah, sure. Yeah, very beginning stages and quite exciting actually. A good development that I think in Renfrewshire we felt was a gap for opportunities to be able to bring people home that perhaps their care could be completed, their hospital level care could be completed at home. We accepted our first patient on the 30th of May. so very recent, and been working very closely with the geriatricians within the RAH. Our hospital at home model is embedded within the frailty pathway. So it's very much looking for people that are presenting at ED or through our assessment units within the RAH who are Renfrewshire residents and whose circumstances support the ability to be able to provide that hospital care at home. So it's a very, as Karen said previously, a very person-centred approach. We have 6 staff in post at the moment, 3 advanced practitioners and 3 assistant practitioners at healthcare support level, as I said, working alongside a number of their geriatrician colleagues. And currently we've had 14 patients through the service, and that's saved an equivalent of 77 bed days currently, and it's really hard to estimate given that we're so early, but majority of people have an average length of stay of between 3 and 4 days. What we discovered quite quickly, there was a barrier in relation to a Monday to Friday service, which was something we discussed with Scotland and not seen as a barrier, but it felt a barrier in Renfrewshire, so that's been remedied, and the team have worked really well for that. We want to get, you said 50 beds, so currently we're sitting at 5 patients at the moment, and we need to increase that, and to increase that we do need to think about the resource to be able to do that. There is a couple of posts that are not yet filled that are in progress that will allow us, I think, to go between 7 and 10 beds, but to get to the ambitions of Greater Glasgow and Clyde and the Scottish Government, we will need further investment to do that.
Colin Neil.
Thank you. Really just to pick up on some of the other points that have been made, I think this level of investment is an opportunity for us. It's been very clear through Scottish Government that on kind of successful maturity of these schemes that the funding can then become recurring. It is a range of schemes that we've pulled together ourselves, so it is our own schemes that we feel have got the ability to make that difference, and I look forward, I hope, 1, to see the approval through here, but 2, then to see the monitoring of that going forward and actually seeing this funding having an effect that it should do. Thank you.
Thanks for that, Colin. Any other questions, comments? No. Okay, can we agree to note the report? Approve the report, sorry. Right, so that should take us on to the item 13, which is the IGB Audit Risk and Scrutiny Committee updates. Oh, we missed 12?
Yeah.
Right, sorry about that. That's the IGB Audit Risk and Scrutiny Committee annual report. So it is page 417 in your pack. Add up, so. Okay, Max.
The report itself is quite self-explanatory. It's really just to take the IGB through the work that has been done by that committee during the year, and the key part of that has fed through into the draft annual accounts that you approved to go public earlier, and particularly around the governance statement and all the work that's done around the controls. So happy to take questions, but the paper sets it all out.
Okay, thanks for that, Max. Any questions? Any online? No. So can we agree to approve the recommendations? That moves us on to item 13, the IGB risk and update to yourself. Just a verbal one, Max, if you want to give one.
Yeah, as per the previous paper, the work that's been done, we've done a lot of training as well through that committee just to bring members up to speed, and I think that's been well received. And the internal audit leads have been working with me over the last year to make sure that members of that committee feel equipped to perform their role within that, so that will continue. So I guess that was, that's not quite my last meeting. I've got one more before I think I formally hand over to Lisa Marie, but thanks to everyone in that committee and the work, particularly the finance team coming through. So nothing more to add. Thanks for that.
Well, that just leaves us with the date of the next meeting, which will be held the 19th of September. And it'll be over to yourself, Mags. That's it. So it just leaves me to thank you all for all your support and encouragement since I took over the post 2 years ago. So I can't believe how quick it's flown by. But there we go. So thank you all, and we'll see you at the next meeting. Cheerio. I can't believe it's been 2 years. It's unbelievable. Since that day Friday when I'd been sick through the night, it was terrible. I worked in the dinner. It's just